Ladies and gentlemen, it's been a while since I've done a story on cancer. Now, one thing we are doing much better in some areas of cancer. It was even much worse when my father passed from cancer of the pancreas. But today we're going to talk about cancer of the liver and fatty liver and who is getting it the most. You will be shocked. It's not us. At one point in time, we were at the top of the list, but we're not lingering at the top so much anymore. But, cancer is one of those things we are going to have to work at throughout our lives, no matter where we are on the list. It's something you should always be aware of, and especially if there are certain things that run in your family as far as cancer is concerned. So let's get into this story. New studies suggest race and ethnicity play a role in liver cancer. So, overall, cancer incidence in the United States have decreased, but liver cancer is one of those exceptions. Each year, about 25,000 men, 11,000 women get liver cancer, an increase by 48% since 2000, according to research. Now, a new analysis of liver cancer published on September 5th in a clinical this is a clinical study, and it provides insight into emerging trends in racial and ethnic differences. Since 2015, there's been a decline in liver cancer from hepatitis C, likely due to the event of direct acting antivirals, but an increased incidence of liver cancer from fatty liver disease, reflecting rising rates of obesity and diabetes in the general population. Yeah, absolutely. So there's a false notion that the rates are stable when in reality, certain risks are actually rising and need to be addressed to improve prevention efforts. All right, so let's look at who is getting it. And it really depends on what group. And I know sometimes we have people classified as Hispanic or Latino, and we also have us where we got black people, but of other ethnicities. Okay. And you'll see where this makes a difference when we get into the story. So, this is especially important because liver cancer is highly fatal with a 5-year survival rate of only 18%. The study found that race and birthplace influence the cause of liver cancer, with clear differences for various groups, and even within some groups who are often lumped together. Don't that sound familiar? How we all get jumbled up together, although we are actually different. And the disparities appear to be tied to socioeconomic factors. Information by subgroup allow us to identify which patient groups are the greatest at risk of developing liver cancer. All right. So, who does it disproportionately impact? People with lower income, less education. So, liver cancers caused by hepatitis B or C, viral infections, fatty liver disease, alcohol related disease, but the limitations or focus of those earlier studies did not allow for a deeper dive into the most common causes specific to racial ethnic groups. That information is necessary to develop effective prevention and control efforts, those most vulnerable. Okay. Liver cancer disproportionately affects people of low socioeconomic status, as well as immigrants, veterans, and incarcerated populations, groups which are rarely included in clinical studies because they have limited access to health care. All right. For this trial, investigators took advantage of Florida's rich ethnic diversity, which allowed them to uncover patterns in detail of racial ethnic groups such as Central Americans, Cubans, Dominicans, Mexicans, Puerto Ricans, and South Americans instead of Hispanic/ Latino only. Researchers were similarly able to look at differences between African Americans, Haitians, West Indians, instead of non Hispanic Black people. So they are giving you the specific group and who's impacted by it the most. All right, so let's go on. So they did a study that included 14,420 confirmed cases. And these are people that receive liver cancer diagnosis between 2010 and 2018. The data was gathered from Florida's statewide cancer registry and two other public sources. By using three independent sources, researchers sought to reduce potential bias. Researchers found that race and birth country were correlated with different causes of liver cancer, with clear differences for various groups that appeared to be connected. Socioeconomic factors such as income and education. So, this doctor name is Pajero, and his team were somewhat surprised by the different patterns with each broad racial or ethnic group. We tend to characterize everyone as Black, Hispanics, Asians, etc. But for liver cancer, these broad umbrellas fall short, he said. There were significant differences in the cause of liver cancer for specific groups such as Haitians versus African Americans, Cubans versus Puerto Ricans, Filipinos versus Chinese, Pinheiro said. Other findings included threefold difference in liver cancer rates between Puerto Ricans and Cubans, with Puerto Rican men being higher, which authors cited as proof that grouping all Hispanics together can obscure major differences across ethnicity. Filipinos had the highest rate of liver related cancer, they had more fatty liver. Okay, that's what they found in Filipinos. And what they found in Filipinos were the same as what they found in Puerto Ricans, and the Puerto Ricans having the highest rate of liver cancer. Liver cancer from hepatitis B infection is the leading cause of liver cancer among Asians and Haitian born Black men. Liver cancer causes that are increasing, fatty liver and alcohol related, are more prevalent in the Hispanic population. The causes are declining, primarily hepatitis C, are more prevalent in US born white and Black population. So there is hepatitis C, but that hepatitis C among the white-born and black-born US populations is on the decline. For men and women combined in 2018, hepatitis C infections, fatty liver disease accounted for 36% and 35% of all liver cancers, respectively. Identifying differences among and within different races matter because differences cause the different implications of liver cancer, said Pajero. So, Dr. Kim agrees and pointed out in this study that Puerto Rican men had the highest HCC rate, while West Indian born Black men had the lowest HCC rate of all studied groups. Without the detailed data with these differences may not have been as clear as non-alcoholic fatty liver disease and alcoholic liver disease related HCC rates are on the rise, and it will also be especially important to focus on patient subgroups at the greatest risk for these conditions to minimize further disparities in care, she says. Although the data presented is limited to Florida, this study offers a model for evaluating other state and national level data on liver cancer, adds Kim. So the findings should be used to raise awareness of liver cancer and especially among primary care physicians, Pajero, all provided should be following the recommendations of the CDC to screen all adult populations in the US for hepatitis C and hepatitis B. Unfortunately, that is not always the case, and even when screening is done, the specific recommended test is not always prescribed, he said. If a patient screens results in a positive, they can be referred to as liver specialists. So they should go to a I mean, I would think that would be common sense to go to a liver specialist and be treated for hepatitis C, for which a cure does exist. But their hepatitis B can be controlled. Now, that can't be cured, but it certainly can be controlled if you have hepatitis B. So, if it's under control, then that lowers the odds of that person getting full-blown liver cancer in the future. So, these findings could be used to raise awareness about the specific risk for certain groups who are likely to develop different precursors of liver cancer, about hepatitis C for Puerto Ricans, hepatitis B for Haitians, and fatty liver disease for Hispanics, he added. So, ladies and gentlemen, in fact, I was online and I saw they have home testing kits that you can get and you can test for hepatitis B and hepatitis C. That is now available. So, y'all tell me what you think. I mean, are men who, men tend to get it a lot more than women as far as liver cancer and fatty liver, our men did not rank at the top of the list at all, you know? So right now, as far as liver cancer and fatty liver is highest among Puerto Rican men in America. So y'all, please tell me what you think about this video. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.